everybody. Dear friends and distinguished members on the panel, a warm welcome from Alzheimer's Related Disorders Society of India, Delhi. World Alzheimer Month is the international campaign every September to raise awareness and challenge the stigma that surrounds dementia. September 2019 will mark the 8th World Alzheimer's Month. The campaign was launched in 2012, and World Alzheimer's Day is on 21st September each year. 2 out of 3 people globally believe there is little or no understanding of dementia in their countries. The impact of World Alzheimer's Month is growing, but the stigmatization and misinformation that surrounds dementia remains a global problem that requires global action. Delhi chapter is an important stakeholder in that campaign. I now invite Dr. Maitreyi Tripathi, President ARDSI Delhi chapter, Professor Neurology, AIMS, to give her opening address.
Stigma is something which many people, many normal people also feel in their lifespan. In today's world, it's the body image which is often stigmatized. How thin you are or how fat you are is a common stigma. And also your color is stigmatized in many continents. If you are brown or black, you can be stigmatized. So those are, more common forms of stigma which are known to people. So basically, what is a stigma? Stigma is something which makes me as a person, I'm just giving me as an example, feel different from the others. And that feeling is that of discrimination. So that is stigma. So it can be a perceived stigma. That is something which I feel, which is perceived by me. Or it can be an enacted stigma. Enacted stigma is something which somebody enacts onto me. For example, a simple example is, a little schoolboy who gets messy in his clothes or, is appearing different is made fun of by his friends or her friends. So that's a stigma being enacted on, or that's something being enacted on to that child. So both ways there's stigma. It's not something just imaginary which I feel, but it also could be enacted upon by the society. How is it relevant to dementia is what we're going to discuss today. As a doctor, I can say that for us it's a big problem. Stigma is a problem because it leads to a difference in the health-seeking behavior. People do not bring their parents or their elderly to us early because they are in denial of the problem. They want to deny, and there are many families which would say, oh, he's just aging, it's just normal, and they try to rationalize the problem that the person is having who may have incipient or early dementia. So it does cause a problem for me as a clinician because patients are coming in the middle stage and late stage because the first stage of the disease is missed as a part of denial, rationalization or stigma because they don't want to even comprehend or be cognizant of the fact that there is a problem. So that's a problem for me. Stigma is also a problem for the caregiver because the caregiver cannot communicate or cannot, discuss the problem with people close to him, and somebody, who has to be your frenemy to enact a stigma on you, a real true friend will understand your problem. So for the caregiver, discussing it with the other people can also be a problem.
Let's talk about dementia. That's the theme this year too. I think all of you are aware it's a growing problem. Earlier, it used to be said that it is part of developed societies, but now in developing countries, in Asian countries, it's an emerging problem. Yet, people have little understanding of dementia. Even in developed countries, there's not much which is known about it. And organizations like Alzheimer's and Related Disorders Society of India, under the umbrella of Alzheimer's Disease International, are working in many countries to raise awareness. But what we do find, while this advocacy is growing, we still have very limited research in dementia. And that's also because it's still not seen as a problem which is affecting many people, although data is providing us with a lot of transition which is going on. So therefore, very few discuss about the disease. I want to ask you, how many of you talk about it amongst your family members or with your friends? Do you ever discuss that there are people who are affected by it? I think those who have somebody from the family may be doing, but in general, public tends to shy away from this. But you don't shy away about talking of diabetes. You don't shy away talking about obesity. You don't shy away by talking about malnutrition and so forth. We need to look at this also in the light of it's a problem which comes, which can be managed and we can deal with. Then few discuss about the care aspects. Do we realize how much care burden there is in caring for a person who is affected by dementia? ARDSI, a lot of people here are volunteers, are caregivers. They are doing counseling, and they can tell you, maybe later on in your discussion, the burden it puts on the caregiver. So we need to talk more about these things. Therefore, it brings us to the question of management of this disease. And lots is happening there. As I will proceed further, you will also understand. So we need to talk amongst our family and friends about what is happening with dementia, what is to be done in order to better our quality of care, what needs to be done to manage the disease, both for the person and for the families caring for the person with dementia.